Okay, we're gonna go ahead and get started because we have a really packed agenda today. Thank you so much to everyone for joining. This is our fourth annual New York State Children's Environmental Health Center Summer Academy Student Showcase. I'm Dr. Sarah Evans. I'm one of the co-directors of the Academy, and I'm also an assistant professor of environmental medicine and climate science at Mount Sinai. So we want to really jump right in so that the students will have ample time to share their work. But first, I want to thank all of our faculty, partners, and supporters for joining. I'm really thrilled to be able to welcome representatives from the offices of our New York State elected officials today as well. So we have representation from across the state, including the offices of Assembly Members Epstein, Gunther, Gray, McDonald, Suffrant Forest, Paulin, Flood, Lunsford, Levenberg, and Giglio, and Senators Baruch, Salazar, and Harcum. Please do chime in if I missed anyone. And since we don't have time to do introductions for everyone, feel free to introduce yourselves in the chat. And so as you'll hear from our NYSCHECK director, Dr. Maida Galvez, the work that we do at NYSCHECK, including our Summer Academy program, is aimed at improving the health of children and communities. And it's really only possible with the support of policymakers and advocates from across the state. So I'm going to turn it over now to Dr. Galvez to give just a quick introduction to our NYSCHECK network. I will share my screen, sorry.
Thanks so much, Dr. Evans. I am so excited to join you all today. New York State Children's Environmental Health Center. This is literally the highlight of my summer, is being with you together. And so the NYSCHECK centers are the first in the nation state-based network of children's environmental health centers in the country, as Dr. Evans mentioned. I think we're going to get some slides up. It truly takes a village to get these to launch. As you see in this first picture here, the network from across the state, serving urban, suburban, and rural families and their environmental health needs. And you can read about it in this American Journal of Public Health article, Building the NYSCHECK Centers, a Replicable Model. We hope this is the first of many state-based networks in the country. Together with Perry Sheffield, I co-direct the Coordinating Center for NYSCHECK. And it is the fact that it functions as a network is something we're incredibly proud of. Next slide, please. And so there are centers across the state in Albany, Buffalo, Syracuse, Rochester, Westchester, New York City, and Long Island. You can read more about it in the National Academy's proceedings of a workshop toward a future of environmental health. So they're located at those children's hospitals. Next slide, please. And they're serving the needs of families. And so over 95,000 services for families in the past year. 60,000 patients were screened for environmental health concerns, over 8,000 healthcare professionals educated, and over 700 trainees. Next. Something that we're incredibly proud of is the NYSCHECK Scholars Program, which is building the children's environmental health workforce across the state. And you see that we've had now 3 cohorts, the first class in 2020, in 2018, the next class in 2020, and now we've over doubled our scholars in 2023 with 12 scholars across the state. And this is a pipeline of leaders, and it's already seeded leaders. And so you can see in that first cohort, Dr. Amy Brown, who's one of the co-leaders of this Summer Academy, along with Dr. Sandy G, who's stepped into the medical director role for her Finger Lakes Children's Environmental Health Center, as has Sarah Ventry in the 2020 cohort. Next slide, please. What we're doing is making an intentional shift. We're integrating prevention into clinical practice, and specifically environmental health prevention. And so linking pediatric healthcare professionals to environmental health resources that can then connect families to healthy homes interventions that they need, conducted by community partners. Next slide. And so what we're aiming to do is prescribe healthy homes for all families, but especially for children with asthma. And you can see that for many families, home is not a refuge, that it is a place that is a source of constant stress. But we have the ability to connect families to the interventions that they need. And this is an example of the work that can be done. So Little Sisters of Assumption will go in do an assessment and then provide the interventions that those families need. And you can see how this addresses not only peeling pain, but moisture and mold and pest management as well. Next slide. And so across the state, nearly 170,000 New York State families have been screened for healthy homes concerns through the general pediatrics practice and the pediatric pulmonology practice. Clinicians are screening and connecting families through prescriptions for prevention. And the next slide will show some of the interventions that take place. So this is integrated pest management, and these community partners are integral to providing families with the interventions they so need. Protecting children from wildfire smoke was in the news last summer and through the NYSCHECK network and in the news again this summer. And we were able to send out through patient channels of the NYSCHECK network key messages on what families could do to prevent and reduce their exposures to wildfire smokes through all our patient channels through the NYSCHECK network, and reaching millions of families across the state and in the region. And we're especially proud of the pipeline of future leaders in children's environmental health. So Dr. Chase Moon was on a pediatric environmental health elective with us. He's joining our team in August and is already a climate leader. Next slide. And we're here today to hear from those new leaders from the NYSCHECK Summer Academy. And those voices of youth have been the most impactful in affecting change. This is an example of a 5-year-old who sang the proclamation on Children's Environmental Health Day every second Thursday in October. And that's why I'm so excited to join you all today to hear from you all as the new leaders of the field. I just want to turn it back to our Summer Academy faculty, who are truly rock stars, our community partners that co-lead this effort, and look forward to listening and learning from all of you. Thank you, Dr. Evans.
Thank you so much, Maida. So before I turn it over to the students who are really the stars of the show today, I just wanted to give a brief overview of what the Summer Academy is and acknowledge all of the individuals who made it possible this year. So the students participated in an 8-week virtual program where they learned foundational principles of public health and environmental health from our NYSCHECK faculty and partners. And then they worked in mentored teams to apply these concepts to climate change advocacy projects. And this year we had great representation from 40 students from all across the state. And these students ranged from high school students. So some of them were as young as sophomores in high school, all the way through college, medical school, and graduate school. And this is one of the things that's really unique about this program, is that multi-level learners come together and work on these projects as a team. And so the learning objectives of this program, as I said, were really to provide the students with fundamentals of public health and environmental health, helping to create this pipeline of future leaders that Maida described. And in addition to getting that didactic training, they really got to learn to practice how to communicate and create key messages related this year, specifically to climate impacts on health, and to identify change solutions to make change. And so a major goal is really to empower these students as environmental justice advocates. So this is something that they can take forward with them through whatever career they choose. And so our team consists of our co-directors, Dr. Amy Brown from the Hudson Valley, Dr. Sandy G from the Finger Lakes region, Dr. Cappy Collins on Long Island, and our partners at Huntington Breast Cancer Action Coalition on Long Island, Melanie Gabrell and Karen Miller. And this year, our projects were really made possible through the mentorship of some of our environmental health scholars who Maida mentioned in her presentation. And you're going to be hearing a little bit from them about how they guided their students. And we couldn't do this without John Colhane for IT support, our alumni facilitator, Mackenzie Steen. We love to bring our former students back to work with us, and Michael Egiogu's administrative support. And so we had a core curriculum that was delivered from faculty across our network, but also from some really key partners who enhanced our curriculum so much this year, including US EPA, Clean and Healthy with Bobby Wilding, American Academy of Pediatrics, the Rocky Mountain Institute. So students really got to hear from a diverse set of faculty. And you're going to hear about the advocacy projects that they did. And what they were really charged with doing was learning how to do a literature review related to climate and extreme health, extreme heat, to identify who their elected officials were, learn how to look up New York State level policies, explore evidence-based upstream interventions that might address this problem of extreme heat and health, identify vulnerable populations using publicly available databases and mapping. And then, as I said, really learn how to communicate these key messages back to decision makers and propose new or expanded advocacy strategies. And that's what you're going to hear about now. We divided the students up into 4 mentored groups focused on what you all know are very large regions of New York State with very diverse populations, Western New York, Central New York, the Hudson Valley region, and the New York City, Long Island region. And so I'm going to turn it over now to our Western New York group to share their findings.